welcome back to this edition of Like Nobody's Business. I'm Mary Beth Seawald. We are so pleased to have today with us Christine Zach. She is the CEO of Capability Health and Human Services. Christine, welcome to the show.
Thank you, Mary Beth.
Wow.
I'm excited to be here.
Thank you. We're so excited to have you, great member of the Chamber of Commerce. And you just recently went through a rebrand. You used to be Easter Seals, right?
That's correct. We sure did. So we've been around in Nevada since 1976. We were formed as the Southern Nevada Association for the Handicapped, eventually became statewide, changed our name to Endeavor, and then we were an affiliate of Easter Seals until earlier this year when we decided to honor our tradition and our roots in Nevada and really focus on being a Nevada-centered organization. So we're now Capability Health and Human Services.
That's excellent. And how long have you been under the new name?
Since just a couple months now. I think officially since December 1st.
Okay.
We're no longer affiliated, and then we've been operating under the new name maybe 2 months or so.
Wow, how exciting. So tell us a little bit more about who your clients are and how we could get in touch with you.
Fantastic, yes. So we actually serve from birth, infants straight out of the NICU through seniors. And the way I look at it is that any one of us will face a physical or intellectual limitation at some point in our life. And that's where we come in. We primarily offer healthcare services, but we also do offer human services, which I call capability enhancement services. So if you have a child that has a speech delay, or maybe a child that's more medically fragile, has cerebral palsy, we do pediatric rehabilitation through early intervention in the homes from birth to age 3. Then we have pediatric therapy clinics in Las Vegas and in Reno. And if you haven't stopped by to see them, you really should. We have a chill room in Vegas. We have a swing room in Reno. So they're a lot of fun, even for adults. And then if we look at more of a middle-aged population, surprisingly, we serve a lot of middle-aged women with autoimmune diseases. And without our assistance, they won't be able to stay in their home. They would have to move to skilled nursing or assisted living. And then finally, we serve adults with physical or intellectual limitations. And I like to remind people that sometimes those limitations aren't visible. Sometimes it's PTSD or depression or a mental illness. Other times it's an intellectual disability or a spectrum disorder. But we provide skilled nursing for adults that want to be in a day setting, an enrichment services setting. And then we also provide career training and launching into careers in the community for adults that are ready to make that launch. We have the exclusive partnership with Sephora in Southern Nevada, and we train adults with physical and intellectual limitations, and they go through a 9-week program, and if they graduate, which I'm proud to say 100% of our first class did.
That's great.
They become employees of Sephora, making $13 to $14 an hour to start, with other opportunities for advancement.
How exciting is that? You really cover the entire spectrum of potential needs across the entire state as well.
We do. That's correct. And again, that's why we think the rebrand was so important, so that when people are looking for services, that they'll think to look for an organization called Capability Health and Human Services.
That is so exciting. You know, I didn't even realize the reach that you all had and the wide array of services that you provide. So how are the costs covered for individuals?
So early intervention it's really unique here in Nevada, and I'm just so proud of the state for doing this. Regardless of socioeconomic status, if your child is diagnosed with a developmental delay, so speech is the most common developmental delay, the state will cover the cost of services up to age 3. And then we also, for the healthcare services like physical therapy or speech therapy, we're able to bill Medicaid and commercial insurance. For the programs for the middle-aged women that I was talking about, there is federal funding that passes through the state as a grant, and the costs are covered. We're hoping that by early 2020, we're going to be a Medicare provider as well, so we would be able to bill Medicare for those same services. And then for the adults, it just depends. Some of the skilled nursing, or I'd say most of the skilled nursing and the services we provide are effectively covered either by Medicare or by the Department of Education, Training, and Rehabilitation. rehabilitation.
That is amazing. So do most folks come in through their general practitioner or some other means?
So for children, many of them come in through their pediatrician. So we take direct referrals from the pediatrician, or they may come in through a phone number to the state, to the Nevada Early Intervention System. And then with the adults, it's more through something called the Desert Regional Center, or through the Department of Education, Training, Rehabilitation, the Bureau of Vocational Rehabilitation, a lot of different state agencies. The children are where you see more of that traditional referral source in healthcare.
And of all the different types of people that you've described that you see, are there any stories you could tell us that have been any more gratifying than others? I'm sure it must be gratifying to help everybody.
It is. That's a tough one, but I would probably focus on children, just because to me, if you can provide these services to children in that 0 to 3 age range, then they hopefully won't need the services as an adult that we offer. So they can launch into a career in the community or go to college. And we have been really, really fortunate to partner with a family and a little girl named Imogen who came through our programs, and she has cerebral palsy, and she is just so delightful. So she just exited early intervention earlier this year, but she has come and joined us at our children's fashion show and gone down the runway in her wheelchair. And she has also joined us at other events, and she's just an absolute delight. So to be able to work with a child like that who's medically fragile and to just see them blossom is so rewarding.
Yeah, you're so blessed, because not all of us have the opportunity to work so directly with folks and to have such a major impact on their lives.
Yes, that's so true. I actually came more from the senior healthcare space with hospitals and skilled nursing facilities, and this opportunity to work with kids and on pediatric intervention, it is incredibly rewarding, and you really feel like you are epitomizing preventive healthcare.
What would you say are some of the biggest challenges around the healthcare space in our community?
So particularly in Southern Nevada, the reimbursement rates are very low. Now, of course, statewide, I think we all know Medicaid rates are low, but commercial insurances too. I think a lot of people don't realize when they're paying for that expensive PPO plan that they're not looking at what doctors are reimbursed or therapists are being reimbursed. And that's been a challenge not only for us, but other prominent organizations like Cleveland Clinic in Southern Nevada.
So Christine, tell us what are some of the ways that our viewers could help Capability and some of the people you serve?
Come to our website. First and foremost, please, please, please come to capabilityhealth.org and take a look at the programs that we offer, because I promise that every single one of us knows a kiddo that's had a speech delay or sees parents that are struggling to identify what's going on with their child. And there's still this stigma, both with parents and pediatricians, about making a diagnosis with a delay. And so if we could just build the awareness about what to look for, and that there are partners out there that can help, and you can have a child that goes on to not be in a special education classroom, or if that's appropriate, do that, but eventually launch and really just fulfill their potential.
Well, Christine Zach, thank you so much for being such a big part of the Las Vegas and Southern Nevada and the entire state, the community here. We appreciate all you're doing at Capability Health and Human Services. We just really appreciate what you're doing for the community.
Thank you, Mary Beth.
We'll be back with more on Like Nobody's Business right after this.